All right, y'all, before we dive in, let's set the tone. This is The Broken Shift. We speak up for the ones who were silenced. And yeah, I'm Nat. But when I'm feeling the weight of the policy and the pain, you'll hear from Natalie Michelle. That's when you know it's not just personal, it's systemic.
And I'm Marcus J. And today we're breaking down what makes them different. The leadership, the transparency, the staffing ratios, the response time when a nurse says something's wrong.
Sometimes we get so used to the horror stories, we forget to ask, what does it look like when it actually works?
Because yes, there are places where nurses feel safe, heard, and protected. They're just not the ones that go viral.
In this episode, we're spotlighting the healthcare facilities from trauma units to long-term care that have done more than talk about safety. They've built it into their culture.
We're breaking down what makes them different. The leadership, the transparency, the staffing ratios, the response time when a nurse says something's wrong.
This one's for the hopeful, for the nurse who's wondering if there's a better way to practice without sacrificing yourself.
Because safety shouldn't be the exception, it should be the baseline.
This is The Broken Shift, but today we're talking about what it looks like when the shift doesn't break you. So Marcus, let's start with what we know. Culture is everything.
Absolutely. You can have all the protocols in the world, but if the culture is toxic, nobody's following them. Or worse, they're afraid to.
Exactly. In safe facilities, nurses aren't afraid to speak up because they know their voice won't be used against them.
And that starts at the top. Leadership that listens, not just when there's a PR crisis, but every day. Open door policies that actually stay open. There's this ICU I visited in Oregon last year. I asked one of the nurses what made her feel safe at work. She said when our manager makes rounds, she doesn't ask what we're doing wrong. She asks what we need.
Simple, right? But powerful, because that changes the entire energy of a unit. People aren't guarding themselves, they're grounded. And let's talk about peer support. Safe facilities prioritize relationships. They know that nurses need each other, not just policies.
There's even one hospital in Minnesota that has an on-call nurse wellness liaison. You have a rough code, a violent patient encounter, they come to you. Debrief, listen, help you decompress.
That's real investment, not just in patient outcomes, but in the emotional health of the people delivering care.
Coming up in part 2, we break down the operational side. What systems and structures make safety more than just a poster in the break room?
So let's talk structure because culture is beautiful, but it needs a backbone. Real protection means real systems.
Yep. You can't build a safe environment on vibes alone. It has to be baked into the policy, the workflow, the actual bones of the organization.
Let's start with staffing. Safe facilities don't guess their ratios, they plan them, track them, and adjust in real time. Not after 3 nurses call out and 2 codes run back to back.
Some hospitals are using smart staffing dashboards that show acuity, census, and resource availability live, not just for leadership, but for charge nurses to make informed calls.
And tech matters too. Places that invest in reliable equipment, med scanners that actually scan and call lights that don't glitch, show they respect the people using them.
I talked to a nurse from a surgical step-down unit in Boston who said, "We don't fear Joint Commission visits. We welcome them. Because what they see is what we do every day."
That level of consistency only happens when policies aren't performative, they're integrated.
That means incident reports that trigger team reviews, not individual blame. Response teams that actually show up. And when a nurse files a safety concern, there's a documented response, not just a silence and a side eye.
Coming up in part 3, we talk about what happens when safe systems create safe outcomes. Because better culture and smarter infrastructure don't just protect staff, they save lives.
Okay, Nat, now let's talk outcomes. What actually happens when safety isn't a buzzword? It's baked in.
You get better patient care, period. Fewer errors, fewer falls, faster response times, and not because staff are perfect, but because they're supported.
Right. And when nurses aren't drowning in fear, guess what? They think more clearly. They communicate better. They show up stronger.
There's a hospital in California that implemented a full staff wellness and patient safety overhaul. Within 1 year, their medication error rate dropped by 28%.
And let's not forget the ripple effect, staff retention. Nurses who feel safe stay longer, and continuity of care, that improves everything.
Patients notice it too. They don't just feel cared for, they feel seen. The little things start getting done. Rounds feel like presence, not pressure.
And here's something else. In these safe environments, patient complaints actually go down, not because problems don't happen, but because patients see transparency and accountability when they do.
Coming up in part 4, we talk about how facilities make the leap from high turnover and burnout to safety-centered excellence. And spoiler alert, it takes more than a pizza party. All right, Marcus, what do you think flips the switch? What takes a facility from chaos to culture?
Honestly, 2 things. Leadership that's willing to listen and act, and staff who refuse to normalize dysfunction.
Exactly. We've talked to nurses who said change started the moment a new CNO walked in and didn't come with a clipboard. They came with a question, what's broken here?
And then they stayed long enough to hear the answers.
Safe environments are built at the speed of trust, and trust starts with follow-through, not just policy drops in a staff email.
We'll talk case studies, breakthrough strategies, and the real work that happens after leadership finally says, "We hear you."
And then we're going to keep going, because this is now a 10-part series.
Oh, it's on.
This isn't just about calling out what's broken, it's about building what works brick by brick. Wellness can't be a poster, it can't be a pizza, it has to be policy.
Exactly. Safe facilities treat staff wellness like patient safety. Urgent, funded, and embedded in the workflow.
Some facilities are building recharge rooms, offering trauma debriefing after codes, and even piloting mental health check-ins as part of unit rounds.
And when the wellness isn't performative, people start showing up whole, not just surviving the shift.
Take Henry Ford Health in Michigan. After launching their Caring for the Caregiver program, they saw a 45% drop in stress-related call-outs among clinical staff within 6 months. Their program includes 24/7 emotional support lines, peer-to-peer trauma teams, and scheduled wellness breaks built into the shift model.
That's the difference between symbolic support and structural healing.
Nothing works if your staffing doesn't. Full stop.
Facilities that get it right use acuity-adjusted ratios, cross-train float pools, and allow nurses to help build the schedule.
They also protect breaks, not guilt trip them, because a nurse with a full bladder and no backup is a system failure, not a badge of honor.
There's a hospital in Colorado that implemented protected breaks by law, even floated a relief nurse model to cover meals and rest. Within a year, nurse-reported fatigue scores dropped by 35%, and their retention rate improved by 22%.
And that's what happens when you let nurses recover like human beings, not machines. Because rest isn't just about comfort, it's about clarity, accuracy, and staying sharp when it matters most.
Clear communication saves lives and peace of mind.
These facilities aren't afraid of SBAR. They use it. Rounds are team-based. Debriefs are real-time. Nurses aren't just expected to report, they're invited to lead conversations. Take Cleveland Clinic, for example. They implemented a system-wide emphasis on interprofessional communication that empowers nurses to co-lead daily safety huddles. They also integrated SBAR training into ongoing clinical education, and the result? A 20% improvement in interdisciplinary response times and higher scores in nurse engagement and perceived psychological safety. Safe spaces are inclusive spaces.
We're talking equitable hiring, promotion transparency, and conflict resolution systems that actually resolve things, not just document them.
Representation in leadership shifts culture. Diverse voices create safer policy.
I'll never forget what one nurse leader told us during an interview last year. A Black clinical director at a magnet hospital in New Jersey. She said, "When my team saw someone who looked like them making decisions, they started speaking up more. Not because I told them to, but because the room finally felt safe."
That's it. Inclusion isn't just an HR goal, it's a safety strategy. Because when people feel seen, they're more likely to step forward, ask for help, and hold the line when something's wrong.
No blame games. Just culture frameworks focus on root cause, not witch hunts.
When mistakes happen, they're examined with the lens of learning, not fear. That's what keeps people honest and coming back to work. Look at Brigham and Women's Hospital in Boston. They implemented a just culture model across all departments, prioritizing systems improvement over individual blame. Since then, their voluntary incident reporting increased by over 30%, and their patient safety climate survey scores rose significantly. Staff said they felt safer speaking up and more connected to the mission of care. The real flex, keeping it up.
Facilities with strong culture audit themselves. They gather staff feedback before it's a crisis. They evolve.
Take the example of Virginia Mason Medical Center in Seattle. For over a decade, they've maintained some of the highest staff satisfaction and patient safety scores in the country, all because they built a system of continuous feedback and lean management into every layer of care.
Their safety huddles are daily. Their peer support programs are robust, and their leadership doesn't just react, they anticipate.
Because safe doesn't mean static, it means sustainable, intentional, and accountable.
And if you're in a place that's doing it right, tell us. We want to spotlight the wins.
Because this is what the future of nursing can look like. This is the broken shift. Next week's Spotlight: Abuse Beyond Borders when healthcare workers become targets.
Next week, we're taking the conversation global because workplace violence in healthcare, it's not just a U.S. crisis. In Japan, nurses and aides are speaking up about repeated harassment, even physical assaults, by patients, families, and public figures. Some say it's a daily part of their shift.
We'll break down the cultural silence, the failure of institutional protection, and how this isn't about one country, it's about how healthcare workers are dehumanized worldwide.
Because safety shouldn't stop at the border, and respect shouldn't be a privilege.
This one's for every healthcare worker who's been told to toughen up in the face of abuse.
Nah, it's time we call it what it is.
See you next week on The Broken Shift, because nursing shouldn't break you.